Hey everyone, my name is Kathryn Burch. That's ANNA-KATHRYN. My last name is Burch, Burch. I am a pediatric infectious disease physician here at Prisma Health Children's Hospital in the Midlands. And today we are coming to you to talk about a patient that recently was in our hospital who passed away from Naegleria Fowleria. I first would like to say to the family that we send our condolences to you. The people here at Prisma Health Children's Hospital care and just want you to know that we're thinking of your family. I will not be able to speak about any specifics about the patient, being age, name, where the Naegleria fowleria came from, any of those details, but I can ask or answer other questions. We can only speak to what happened in our hospital. I will open it up to any questions that y'all might have.
Dr. Burch, can you just give a general overview of what it is?
Sure.
That kind of general, start with that,
Okay.
general, and then we'll go to questions from there.
Sure. Okay. So Naegleria fowleria is an amoeba that is ubiquitous to any fresh water in the state of South Carolina and honestly in the Southeast in general. So any body of lake, river, pond, hot springs that you could come into contact with in the state of South Carolina will have this amoeba in it. It typically likes to live in the silt in the bottom of lakes, rivers, those kind of things. But as we get hot outside, it increases the number of the amoeba. But in addition to that, when it gets really hot outside, a lot of times water levels drop. So it condenses the amount of amoeba per how much water there is. And the interesting thing is that for most people who come in contact with this type of amoeba, it causes no harm whatsoever. Most of us have been exposed to this amoeba who have been in lakes and rivers and those kind of things. The problem is that it's not an issue when we come in contact with it. That being, we accidentally drink the water, we accidentally get it on our skin, we're swimming, those kind of things. Where it can cause an issue is if forceful water gets up the nose and is able to cross from the nose into the brain. That's where people can get infected with this particular type of amoeba. So, what this amoeba causes is a syndrome called primary amoeba meningoencephalitis. And those are fancy words for saying that this amoeba infects the brain and it makes the brain swell. It is the majority of the cases that have happened in the United States are fatal. Greater than 97% of cases that have occurred since the 60s have been fatal. There has only been 4 reported cases in the United States who have lived with this particular infection, and those who live have variable outcomes. Some are what we call neurologically devastated, meaning that they, might not can speak, those kind of things to you, versus some have made a completely 100% recovery or pretty close to it. So it is something that if and when it does occur, it's very, very devastating.
Dr. Burch, earlier in the day, we were talking about how many cases, I know you've been an infectious disease physician for a while, how many cases you've seen?
Yeah, so, being here in South Carolina, being born and raised in South Carolina, again, this is one of the areas that we see or can see this amoeba. In my lifetime as being a pediatric disease physician here in South Carolina, I've seen 2 cases now of this disease.
What advice then, Dr. Burch, would you give to parents out there who may be concerned about this amoeba and their kids and being out in the fresh water?
Yeah, so there's a couple of things that you could do to help protect yourself and your children from this. Number one would be to be very careful when you are in fresh water, specifically lakes, rivers, again, ponds, those kind of things. Being careful with diving into bodies of water, having some kind of water activity like tubing, skiing, those kind of things where you might fall into the water and it's easy for water to get up the nose. Those activities all increase your risk, of course, for being exposed to this particular amoeba. That being said, teaching your children how to either blow out of their nose if they're jumping in or holding their nose as they're jumping into the water. Or you can do something easy like wearing nose clips that keeps your nose clipped while your children are playing in the water and running in the water. Um, Other things to note is that we don't like for individuals to be digging into the sand or the dirt, especially in shallow water, because that is where the amoeba likes to live. And if we do those kind of things, then that just allows the amoeba to get more into the water, and that increases your chance of being exposed to it as well. When the height of the season occurs, when it's the hottest outside, is the highest risk. Also for this amoeba, it definitely likes very, very hot water. And so that's why we also put hot springs on the list as well. And then lastly, I will say that there have been cases where this particular amoeba can be in tap water. Now, drinking this amoeba is not a problem for anyone. You cannot get an infection from this amoeba if you drink it, okay? But what you can get is an infection if you use tap water in nasal irrigation systems like neti pots or other kind of devices where you can clean or rinse out your nose. You should never use tap water in those devices. If you do use tap water, it needs to be boiled at least 1 minute and let it cool back down to room temperature before you use the water. Or you can always use distilled water or sterile water in those devices as well.
All right, questions, Dr. Burch. Let's see. So the question is, how quickly do the symptoms progress?
So typically when we think about infections, we think about them in terms of what we call an incubation period. And basically what that means is by the time your body sees the bacteria, amoeba, virus, whatever the infecting agent is, until you develop symptoms is what the incubation period is. This particular amoeba is approximately 5 days, but it can range anywhere between 1 day and 12 days from exposure that you would experience symptoms. So it's pretty quick after a freshwater exposure. And that is important for individuals to know, because if you have a child or someone in your family who has been around fresh water, who might have been diving or doing some kind of water activity, and then several days later, they start explaining that they have a very bad headache, or they might start having fever, or they might start having a stiff neck, or even vomiting and diarrhea. Those are all symptoms of Naegleria fowleria, and it's very, very important to let the healthcare provider know that you have had exposure to fresh water. The main reason is because the quicker we can make a diagnosis, the better the outcome could be. of those individuals who have survived with this particular infection, those individuals received treatment very early in the course of their illness.
Okay, the question, Dr. Burch, is, I think you answered this, but I want to just go ahead and answer it. How many cases have we seen in the past year? Has Prisma Health Children's Hospital seen any cases in the past year?
So only this one case in the past year. And I'm pretty sure that's in the whole state of South Carolina that there's only been one case this year.
Yeah, then I guess a follow-up was the South Carolina Health Department earlier confirmed that there was one South Carolina case of this. And is this the same case that you treated?
It is.
How does treatment look like in general terms?
So typically what happens is the patient comes into the hospital, and depending upon how far they are along in the symptoms, most of the time those children end up going to the intensive care unit. And that's because further on in the disease, many of these children suffer things like seizures. They might have to get intubated and put on the ventilator, those kind of higher level hospital procedures that sometimes need to be done. They get started on a large amount of antibiotics and antimicrobials, and that is kind of the best option that we have currently. Because there hasn't been that many cases, there is not great data out there to say what is the best way to treat a patient with this particular infection. And so what we have is what others who have had this infection, how they have been treated, that's what we go on. And specifically, we try to look at what those survivors had as far as their treatment and go on that recommendation. So in this particular case, we did consult the CDC, which is a very typical thing for Naegleria Fowleria, and talk to their experts as well about this, because clearly they are the ones who probably have heard about the majority of the cases and know, have expertise in this particular organism.
Dr. Burch, the question is, it's actually a couple of parts questions, but I'll just start with the first part. Should families avoid swimming in certain areas?
Yeah, so that's always the hard question, right? I mean, again, I was born and raised in South Carolina. I grew up in a body of water all summer long. It's hard, right, to make a decision of taking your kid out of the water when it's such a big part, I think, of South Carolinian summers. And so you just have to make the best decision for your family. The risk definitely is increased when it's hotter temperatures outside, when we get these 100-degree days. So if you do happen to go into the water during those times, I think having a discussion with your children about why it's so important to learn how to not get water up the nose, have things like the nose clips out there, maybe decide not to go on the tube and just float around with floats and those kind of things instead, might be a good thing to do. And it's very hard, right, to tell a child to get into water or be able to get into water, but not put your head underneath the water. So that probably is not too much of an option, but that is something that you can do as well, is just get in the water, but not put your head underneath.
Another question was, are there red flags? What are red flags in that, about swimming areas? Would there be a red flag?
I think the red flags, I guess the question is like, what would constitute like a higher risk?
Yeah, because it was a two-part question. It was like, should families avoid swimming in certain areas, and what are the red flags?
Yeah, I think really what you need to pay attention to is how hot it's been outside and what the water temperature is. The higher the water temperature, the higher the risk.
And then the other question, I think you kind of addressed this, but I'll ask it anyway. Should parents be concerned about activities like nose diving, water slides, and dunking?
Yeah, I mean, you always worry about water that can go up the nose, and this is fresh water. Now, in those cases where you have water slides, right? If you are in a pool or in a splash pad or something like that, those are typically chlorinated, and chlorination will kill this amoeba. So you don't have to worry about swimming pools and splash pads and all those kind of places. But if you are going down, any kind of recreational, um, jumping into ponds or lakes or something like that, where you might have like a bounce and you're going into the water or something like that, then yes, you should be careful about making sure that you don't get water up the nose.
And I asked you this yesterday because I was interested in it. So people who are going to the beach don't have to worry about that. Is that correct?
That's correct. So salt water, this amoeba cannot live in salt water or brackish water. It is only fresh water. So thinking of rivers, lakes, ponds, hot water springs, those kind of things.
Right. So let's see. Are certain age groups more susceptible to this infection?
No, but it's interesting that if you look at who is at largest risk, and we don't know why, but it is, you know, uh, males. And we don't know if it's because they, swim more, they might dive more, they like to do things like go tubing and that kind of thing. But pre-adolescent, adolescent males are at larger risk. But again, nobody has been able to identify why that is the case.
Okay, so a question is, why does it survive in tap water if tap water also has chlorine added?
Yeah, so it's not in all tap water. It just has been found in certain tap waters in the past. And we know that because there has been a case or two where someone has used tap water in a neti pot and got Naegleria fowleria from that. But if tap water is chlorinated, then it should not be able to be there.
Let's see. Okay, so I know there's parents out there who are, trying to figure out what to do. What would, if you had to give some parents some advice, Dr. Burch, what would that advice be?
I think the advice would be to know, number one, that this is a very rare infection. You have to have the right timing with the right amount of pressure of water up the nose to get the amoeba into the brain. And that's why it happens pretty rare in the United States, less than 10 cases per year. A lot of times those are in the Southeast. That being said, I think that you have to make the right decision for your family, but being educated about the risks and what Naegleria fowleria is the most important thing. So if you can have a good conversation with your kids about not splashing, not diving, those kind of things, then I think that it's safe for you to be able to go into the water. We shouldn't be afraid to be in lakes and rivers and those kind of things. Again, it's a big part of what South Carolinians do. I just think that you need to be safe when you go into those bodies of water. If that means that, your kids are a little bit young and you might not be able to have those conversations with them, then maybe the nose plugs might be the best way to go.
Dr. Birch, there's a new question that is, what is the protocol for reporting this kind of case?
Yeah, so Naegleria fowleria and other forms of PAM, which is that primary amoeba meningoencephalitis, that's what this patient had. It's not reportable in the state of South Carolina.
Okay. Dr. Birch, you mentioned something about sand, and that was the first time I had heard that before about. Can you just talk about that a little bit more?
Sure. So any of the silt, sand, debris on the bottom of rivers, ponds, lakes, those kind of things, is where the actual amoeba lives. Okay. So If you're digging up, because we all, when we go into the water, some people dig up with their feet or they dive down and dig up with their hand, those kind of things. As you do that, it suspends the amoeba more in the water. And so we recommend that you just leave the bottom of the lakes, rivers, ponds alone and don't mess with the soil that's on the bottom.
Give me 1 second, Dr. Burch. Let's see. Okay, so question is, what does not reportable mean? Does it mean there is no state requirement? What does that mean?
Yes, it's not a reportable disease. So meaning that if you have a case, you are not legally responsible to report it to the Department of Public Health.
So, and of course, like you said that we reported it to we work with the CDC. Is that correct?
That is correct.
Anything else? I'm just trying to make sure we don't have any other final questions. And Dr. Burch, can you talk a little about, so your job at, tell us about what your job is at Children's Hospital.
My job, I'm a pediatric infectious disease physician. And so that means that when I got done with my pediatric residency, I did a fellowship in pediatric infectious diseases. So any major infection that a child might have, like complicated pneumonias or meningitis or meningoencephalitis, like this kid, major bacterial infections, I get consulted on and I help out with antimicrobial management of those patients. I also kind of help with diagnosis of infectious disease as well. So knowing maybe what kind of tests to do and those kind of things. And in this particular case, I will tell you this, that I'm really proud of our children's hospital because it was a combined effort to make this diagnosis, and we had very good teams that worked together to get this diagnosis made very quickly in the scheme of this infection. And that goes from the residents, the attendings, the PICU attendings, which is intensive care, the attendings on the floor, all the way down to the pathologist who made the diagnosis.
Okay. Question is, if it is not mandated to be reported, how do you know if it is a rare occurrence?
Yeah, so you can go onto the CDC and look at the cases. I don't think I can comment any more on that because I don't know exactly what that is. Maybe reach out to the Department of Public Health for that.
Right. Good deal. Is it difficult to diagnose?
It can be. And the reason why is because sometimes, a lot of times, because it's so rare, it might not be on the radar of a physician. So that's why I tell parents out there that it's so important that if your child has been in fresh water and they come in with headaches, fever, stiff neck, those kind of things, to make sure that the provider that you are seeing knows that your child has recently been in fresh water. It's also important to know if your child had any water that went up the nose, or if they have been diving or tubing, skiing, those kind of things as well, because that can clue in a provider on whether or not we do the testing for this particular amoeba.
All right. I think that's all of the questions. There's one other question in the chat, but I don't really think we can. It might be like a DPH question. All right. So I think that's all of the other questions. We thank y'all. We thank you, Dr. Burch, for sharing your time with us and being able to help us get the information out to the community. We thank you to our media partners for joining us today. I know it's kind of a quick turnaround, but we appreciate y'all too for jumping on and helping us get the information out to the community.